A lot of patients have a lot of confusion regarding the size, the nature, the surface, and the type of implants that they want me to put. And in this video, I want to clear certain things about the type of implants and what are the different characteristics and what decisions have to be made before going in for the procedure. Hello, I'm Dr. Arjun Handa. I'm plastic surgeon at Handa Aesthetics. So I've got three implants in front of me. One, as you can see, is shiny and smooth, and the rest are a little dull to look at. They are not as shiny. So these are nano-textured implants, and this is a smooth implant. Another difference that you'll see between the implants is their height. This implant is much taller than this implant. So when I put the scale, it's like kind of oblique. It's not horizontal. And this implant is slightly even more smaller than this implant with respect to its height. If you look at it from the top, they are roughly same in the diameter. This is slightly larger, but even then the diameter, the difference is not that much as when you compare the projection of the implant. And this one is also the same in the diameter, but the projection is a little lower. So automatically this is the lowest volume, this is the medium volume, and this is a little slightly larger volume. With respect to the exact cc's, this is around 200 cc, this is around 300, and this is around 400 cc. That is ml. Now, how do we decide which implant has to be put? So let's first look at the differences. As you can see, this is smooth. So smooth implant is something we choose when we are putting the implant purely under the muscle, because this implant, when put under the gland, has a higher incidence of something called as capsular contracture. On the other hand, nano-textured implants have a lower incidence of capsular contracture when put under the breast tissue. Now, under the muscle, actually, the incidence of capsular contracture is the same. So when the breast tissue is going to be in contact with the implant in any manner, whether it's completely or in a dual plane, we would prefer nano-textured because smooth implants have a higher incidence of capsular contracture. Another difference is the projection. Now, projection is important when the patient body is a little larger, when the distance between the nipple and the collarbone is a little larger, the skin is a little loose. If all these things are a little larger and loose, then I would want a higher profile implant to fill the space. If I use a smaller implant, the tissue is going to sag, or the projection is not going to be enough because the patient is taller and larger, the body frame is larger, so the result will not be adequate. Finally, it also depends upon whether the patient wants a natural or a little more fuller look. Now, when I pick up this implant or this implant, on the side view, they are maintaining their shape. You can see that they are not sagging down. On the other hand, this implant, as soon as I pick it up, it sags down. So this implant is something called as a teardrop implant. So when the patient is going to be standing, it's going to take the shape of a natural breast and going to give a more natural result. Now, this might be appealing to some people, but not all, especially if you want to be a bikini model or you want to show off your cleavage or you want fullness in the upper part of your chest, then this type of implant which retains its volume in the upper part is better. But on the other hand, if you're just doing it for private reasons and you just want a natural result, then a teardrop implant will be better. It also depends upon the thinness of the tissues in the body. If the patient is extremely thin and it's not going to hide the borders of the implant, then again a teardrop is better. But if the patient has some muscle mass, some fat in the body, then a higher projection with the implant which retains its shape is better. Finally comes the consistency. This implant is a lot harder. This implant is very soft, and this implant is somewhere in between. Again, the choice of the implant then depends upon the amount of tissue the patient has naturally. If there is absolutely no tissue, then we would go for the softest implant. But if there is some tissue in the patient, then a firmer implant might be better to retain the shape, to give more projection, and to give a better result overall. So it's not just about the size, but a lot of variables go into choosing the right implant for the patient. So when a patient comes and says to me, I want this implant of this size because my friend got it done, it has no meaning because your body, your tissues, your size, your dimensions, your requirements are absolutely different. To give the same result, I would have to choose a completely different implant.